Clinical Use Reports Number 12, Core Measure, Electronic Copy of Health Information. Objective: provide patients with an electronic copy of their health information, including diagnostic test results, problem list, medication allergies, upon request. Measure: more than 50% of all patients who request an electronic copy of their health information are provided it within 3 business days. Denominator: number of patients of the EP who request an electronic copy of their electronic health information 4 business days prior to the end of the EHR reporting period. How the denominator is measured in WRS: patient management, comments, patient requests. A request is dated, and this initiates the 3-day period of providing a copy of their health information. Numerator: number of patients in the denominator who within 3 days of a record request, the continuity of care record is viewed or printed, or view all notes is viewed or printed, or view health record is viewed or printed, or CCD is generated, viewed, or printed. Exclusion: any EP that has no request from patients or their agents for an electronic copy of patient health information during the EHR reporting period. I'll first run the report before we initiate the copy of the electronic health information. I've added 5 days to the reporting period for this demo because the last day that a record request is considered for this report is 4 days before the end of the reporting period. So we currently have a numerator of 1 and denominator of 3. Now I'll look up a patient, David Carter. Now I'll go to Patient Management to initiate a records request. Now go to the Comments tab. Under the Patient Request section, click Add Request. This now initiates the records request, which will add this patient to the denominator population. Now let's go back to the Meaningful Use Reports. I'll run the same report again. We now see that the denominator has increased by 1 to 4, while the numerator stays the same. Now I'll view or print the continuity of care for this patient. Run the same report. The numerator has now increased to 2 from printing the continuity of care record. I already initiated a records request on Agatha Bloom. I'll now click the View All Notes link on the EMR All Notes page. The All Notes screen appears. If I run the same report, the numerator has increased by 1 to 3. I'll initiate a records request for patient Jim Grayson, which will add him to the denominator. Click the View Health Record button from the right-click menu. This will add Jim Grayson to the numerator. Now I'll run the same report again. The numerator has increased to 4 and the denominator has increased to 5. Another action that will add a patient to the numerator is viewing or printing the patient instructions button within the note. I already added the records request for this patient. And the numerator have both increased by 1. The last place that will count toward this measure is in generating, viewing, and/or printing the continuity of care document. XML file format that is used for electronic exchange of health information. It is anticipated that this file format will be used more in the future to exchange data between the health information systems. The file on the EMR All Notes page. I'll now open the XML document that was created. The document can then be saved to a local file or drive.